Oh, hi. First off, you guys have the biggest brains of anyone I've met, and you could probably do anything you wanted with them. But thank you for choosing breast cancer research. And here's my question. When I first started listening to the panelists years ago, Dr. Graylow had done some studies on women who exercised, and I'm hoping to quote this correctly, but it demonstrated that women who were more fit would lowered predisposition to get breast cancer. Is that correct? Mm-hmm. So my question comes with the inflammatory component. Were these studies controlled for NSAID and COX-2 inhibitor use?
What a cool question. It's a great question.
Andy and I, Andy can actually speak to this because he's been an author on at least one of the large studies that suggested that aspirin in particular was associated with a lower risk. But to boil your question down to a very scientific focus, the question is, are the thinner people also overusing the non-steroidals, and therefore what we're seeing is the protection that the non-steroidals might offer?
No.
Masquerading as the benefit of thinness. And I don't think there's good evidence that that's the case right now, that there's a real association between body mass index and the overall use. New York is especially challenging. Andy will correct me again, but anywhere from a third to 50% of the people we screen use non-steroidals in any given month. So it's very hard to find a population that isn't exposed to them in some way or another. The data's been somewhat mixed. There's been some protection against estrogen receptor positive breast cancer in particular, which is part of where we got started. But other studies have not shown it, and the idea that we're working on is that most but not all overweight people have an inflammatory lesion. Thin people usually don't have it, but some will, especially, for example, with aging. And that certain non-steroidals, given in the right way, might turn out to be protective, but we haven't nailed that down yet. So go ahead. Andy's always going to fix me up here.
No, I agree 100%. Actually, 200% to correct myself from the previous answer. I'll just make one point, and that is, and maybe it's subtle, but the term anti-inflammatory, which is one that we all use when we refer to non-steroidal anti-inflammatory drugs, that confers a message which is only partly accurate. Inflammation is a very, very complex beast. And for example, what the non-steroidals do is they work on one limb of a very complex process. So if you were trying to turn off the water in a faucet with an anti-inflammatory, the prediction is that non-steroidals would be partly effective. And so if they're partly effective, that leaves a lot of room for improvement. And so we work very hard now on trying to figure out ways above and beyond the use of non-steroidals that may attenuate inflammation. So that's rather long-winded. I do believe that there is a role for non-steroidals, but again, you hear a lot about personalized or precision or individualized medicine. I think the same will be true for prevention. And so we have to work hard to figure out which subset of the population is most likely to benefit from a particular type of preventive intervention, such as use of aspirin or aspirin-like agents or COX-2 inhibitors.